According to the latest government statistics, the Western Cape has 643 confirmed COVID-19 cases. That's the second highest in the country after Gauteng. The province is ramping up its efforts to try and reach many people in communities for screening and testing if needed. This afternoon, the MEC for Health will open the Mitchells Plain Hospital Testing and Triage Centre as part of its upscaling of mass community testing. Our reporter Mariska Botha and cameraman Marc Müllenberg are joined by Dr. Saadiq Kariem of the Western Cape Department of Health.
Good afternoon to you. Yes, as you rightly said, there we are in Mitchells Plain, where this new testing and triage centre will open a little bit later this afternoon. But the man who knows exactly what's going on in the province in terms of COVID-19 is, as you said, Dr. Saadiq Kariem, and we'll speak immediately to him. Thank you for speaking to us this afternoon, Dr. Kariem. First of all, maybe just give us an overview. What does the situation look like in the Western Cape?
Sure. Look, I mean, as you know, the response in the Western Cape to date, let me say, has been an aggressive response. It's in fact led by the Premier and his entire cabinet personally. They're meeting regularly daily, and Health Department, Western Cape Health Department is obviously the lead department in that response, but it's a multi-sectoral response from the province. So I'm quite comfortable that we have matters under control at the moment. Our response generally from the health side has been led by the epidemiology of COVID-19, the epidemiology of the pandemic, and that helps us determine the strategy. So we've got a number of strategies in place. One of them, key focus has been the primary health care and hospital focus, obviously. But in order to supplement our screening and testing strategy at the PHC sites, we have rapidly, since the 4th of April, started and implemented and started a community screening and testing strategy, as announced by the President. So we've done quite well thus far. We've in fact successfully screened almost 20,000 people already across roughly 42 sites across the province. And we've tested around 1,400 of those that we felt met the criteria. So, and the intention going forward is to further expand that rapidly over the next couple of days.
Why is it important that you get to communities on a ground level to be able to do that screening and testing?
So obviously we're following this epidemiological approach. So we're looking at where the index cases are, and we do it in polygon concentric circles in order from where we find the cases. And we also need to make sure that we're particularly focusing on the vulnerable communities, because the risk of spread is quite high. Obviously it's difficult to do social distancing sometimes, and I really want to implore people to observe the lockdown. We are finding that it's difficult. We understand it's difficult for people to do that, but it's important that they do that. So our focus has been on the more vulnerable communities, in fact. So we want to rapidly expand our community screening and testing and make sure that if there are any positive cases, that we're able to pick them up early. Early identification obviously is quite critical to the success of our campaign.
What does the screening entail? Talk us through a screening.
So screening means that we take the case definition of what would become a person under investigation, and there are a couple of questions that would be asked in terms of the case definition. If the community health workers feel that this person possibly requires testing, they will be taken out of that area and will be taken to a little field testing site, and where the sampling and the swabs will be taken. That gets sent to the laboratory, and obviously the testing gets done at the laboratory. And with that, we've also made sure that we're also matching our laboratory capacity with the ramping up of the screening and testing campaign and strategy. We currently in the province can do roughly about 1,000 tests per day. As of tomorrow, in fact, we will be adding another 1,000 tests per day capacity to our arsenal. And roughly towards the end of April, we'll be adding about 900 tests per day on mobiles. We have about 7 mobiles that's coming, and each mobile will have 4 little machines on them called Gene Expert, and those will be able to do about 128 tests per day over the 7 mobiles. So that's another 900 tests per day. So we're making very sure that we're ramping up our laboratory testing capacity to match the community screening campaign.
And Lastly, and just very, very briefly, a man was arrested for spreading false news, saying that the testing kits is spreading coronavirus itself. Is the testing safe?
The testing is safe. Remember, these testing go through rigorous scientific analyses, and I really want to say that it is actually illegal to be spreading false news. In this province, we will hope to take a very hard line against people who spread fake news like that, because it is critically important that people in the communities understand what we're doing, why we're doing it, and at the end of the day, we ultimately want to look after our community.
Thank you very much. That was Dr. Saadiq Kariem of the Western Cape Department of Health telling us, explaining exactly how the province is ramping up their efforts to get to as many people as possible for screening and testing where and when it's needed to try and get this pandemic under control.
Mariska Botha coming to us live from Mitchell's Plain in Cape Town.